everyone, and welcome back to the Mind Movement Health podcast. My name is Kate Boyle, and today I have a very special guest on the show. Welcome to the podcast, Dr. Evelyn Higgins.
Thank you, Kate. It's my pleasure to be here with you.
Well, I'm super excited today because we're going to be delving into addictions and pain, which is a topic that maybe isn't often talking about enough, but something I
Right.
know affects, everyone in a certain way, whether or not it's themselves or a loved one or a friend, a family member. So before we dive in, can you please introduce yourself to our listeners?
Sure. I'm Dr. Evelyn Higgins. Been in clinical practice for some 36, 37 years. Started out in pain management area and then moved into decades later into the addiction area. And kind of happened by initially, I am practicing in a rural area and I'm seeing kind of a try this, try that approach to treatment. And I see people become somewhat dependent on medications. Then, some 20 plus years after that, I'm in an urban area and think, okay, this is going to be more progressive. There's going to be more tools to use. And it was no different. It was try this, try that, random, and seeing people moving from dependent to addicted. And then that was my professional life, personal life. I married a man who was an alcoholic. A year after our daughter was born, found out that he was adopted. We knew nothing of his health history, and I was seeing behaviors in him, behavioral health, mental health issues, and obviously his addiction. I'm like, what do I need to know from a genetic standpoint? As being mom, I'm responsible for another life. What do I need to know? And the science has evolved greatly since then to the place that we operate out of today and what we do at Wired
Hmm.
BioHealth, Wired for Addiction.
So you mentioned genetics there. Let's start there because I
Sure.
think that's the sort of fascinating side of addictions that a lot of people don't talk about.
Absolutely. Absolutely. So you're born with your DNA, right? Here's your cards, play them out. We now know through the study of epigenetics that the expression of your genes can change. Genes can get turned on, genes can get turned off. The DNA remains the same, the expression can change. So that to me gives the power back to the individual. If and in our DNA, we all have strengths, we all have weaknesses, all of us do. Even if we think we're the perfect specimen, we all have weaknesses somewhere. So it's identifying where those are and then the impact that they have on us. Some of them may be not really any issue at all. Others could really affect different parts of our health. So that part, to me, is the most fascinating part of science that exists because it can change your future. It can give hope to people. It can give the power back to the individual. And you don't have to sit there saying, this is my destiny. This was my mom. This was my dad. This is what's going to happen to me. There's so much that can be prevented. And when we're in the behavioral space, when we're talking about mental health, when we're talking about addiction and how that crosses over with even just pain, let's say, depression is such a big factor in that, from pain to addiction. No one wakes up that day, says, you know what, I think I'm going to be an addict. I'm just going to ruin my life. I'm going to ruin my family, my friends, my job, lose my home, all the things that can go along with that downward spiral. It doesn't work like that. The individual doesn't even realize that they're trying to self-medicate and not knowing that's what they're doing. It's just, hey, whatever their thing is, when I drink, when I gamble, when I have sex outside of my relationship, whatever, I feel good. That's self-medicating, not even realizing that that's what they're doing. And no one would reach outside of themselves to bring something from the outside in to change their resting state unless there was a need to say, I can't articulate this, but this doesn't feel good. And when I do that, it feels good
Hmm. And
initially.
when it comes to genes, is there specific genes that sort of are linked to an increased risk of addictions? And if
Sure.
so, can people test for them?
Yes. Yes. Great questions. And yes, it's not like here's your gene for alcohol. Here's your gene for gambling. It's not that. It's the neuropsych genes altogether. And there are some genes that make you more predisposed to addiction. But beyond those, even in the neuropsych, one example that I'll talk about is the GAD1 gene, the glutamic acid decarboxylase gene. That's responsible for taking glutamic acid, which is a stimulant, brain chemical, and converting it to GABA, which is a calming brain chemical. Well, if we have an error in the coding of that GAD1 gene, we're never going to reach the calm. So many people that get into that self-medicating and wind up with substance abuse and use is because they're looking for that calm, and they're not going to get it otherwise. I mean, even if you take a Valium, there's something that's prescribed in that moment, but it doesn't change the expression of those genes. So that can be done. That's powerful. That's powerful. But first we have to identify what they are, or else we're just guessing. And that takes forever. Take this, try this, half this, double that, that whole cycle that people get into. But yes, we can specifically identify this is what we need to optimize.
Mm. And is that becoming more regular in treatment protocols now, or is it an emerging model that still needs time to sort of start to integrate to sort of regular practices?
Sure, it's becoming more and more. I mean, that's what we do. So every day we are talking about this. We have people coming to us literally from all over the world. We have quite a few patients from Australia, but it's becoming more and more mainstream, and that's where these kind of conversations need to happen. Otherwise, people would never hear of it. They wouldn't know this is going on. And when we do explain it, they're like, "Whoa, you got to be kidding me! This makes so much sense." So rather than sit in this is my doom and gloom, this is the road I'm going to go down, changes can be made. And even to a point of oftentimes we'll have a parent come to us and say, I've never seen this behavior in my child. They turned whatever age, they turned 14, they turned 21, whatever. All of a sudden, this is a different kid. I have no idea what's going on. So we do a panel on them. We look at it and say, these genes were always there. They were never turned on. What happened in your child's life between 19 and 20? Well, they went away to college. They're making decisions for themselves for the first time. They're trying to manage school, uni, and they're trying to manage a part-time job. They're, for the first time, in charge of their own schedule. When do they go to sleep? When do they eat? Do they eat? Do they go to sleep? They have a whole new set of friends. So literally, that person's entire environment has changed. Those genes were always there. We just never saw them because there was no need for their body to say, hey, turn these guys on. This is what's happening now.
Mm-hmm. And how big a role does stress play when it comes to that as well?
Great question. Huge part, because that's where we're going to see the expression of negative things come out. When your body is stressed and it's working harder to try to just stay on target, and all of a sudden these genes get turned on.
Mm.
And the weaknesses really show up.
Yeah. So that's really interesting because even in my own family, I've got a brother and sister with a very strong history of addictions. My mum was a smoker as well. So I always looked at it and went, it runs in the family. I've got uncle and stuff, alcoholic. So I was like, there's a line in the family. So for me personally, I always steered clear of
Right.
alcohol, gambling, because innately I'm like, I can see within my family tree. So I was like,
Right.
I definitely think I'm predisposed to it. I'm not interested right now, but who knows if, that's present in my family.
Exactly. And really up till now, that's all we had. It would be like, well, remember Uncle Joe when he goes to a family party, they have to carry him out. And they'd identify the different family members type of situation. But that's exactly what's going on. And from a preventative aspect, when let's say a parent has it done on a younger person, I'll say, you're at an age where your friends are going to say, hey, we're going to try this, we're going to try that. And you're going to be somebody that wants to do it again versus your other buddies who, if there are no genetic weaknesses there, they're not going to have that same response that you're going to have. They're not going to have that same feeling that you're going to have. So going into the game of life, this is really good information. You still get to make your own choices, right? You still have free will, but know where your weaknesses are and how are you going
Mm.
to play it out.
Yeah, especially as you said, for parents who may have teenagers when they are starting to go through times where they're moving away or they're experiencing a lot more stress or there's changes in friend situations. I know
Yep.
in my family, they were the triggering years for my brothers and sisters to start to move
Mhm.
into addictive behaviors.
Yep. Yep. And that's exactly it. During those years when you're trying to figure yourself out and you're with all these different people until you kind of get that, oh, here's my posse, here's my group, right? And you're going to be have the opportunity to do different things that you may not be able to pedal back from.
And you mentioned before dependency and addiction. Can you
Mhm.
explain the difference between the two and how does someone work out where they're at on that scale?
A fine line. Sure.
Yeah.
So, yeah, so it's kind of a paralysis, right? It's not just a here's the line of demarcation, but dependency of like, oh, more, this makes me feel good. More and more I want to use it versus physiologically now you've used it so much that you've changed how your cells interact with each other. And now they need it physiologically to function. Like you see somebody, just think about alcohol, the easiest. When someone has the DTs in the morning, they're shaking. They need that drink. Physiologically, their body needs that drink to stop shaking. Their body is now physiologically dependent on it. So that started with abusing and dependency to, I have to have this to function.
And, speaking about alcohol, that similar situation can be thought of in the sense of coffee, in that people get addicted to coffee and they will have withdrawal symptoms like, headaches and brain fog or even jittery. Do we say, coffee it's a legal substance? Do you know what I mean? It's got health
Right,
benefits. So do we
right.
still count that as an addiction or do we count that as a dependency? Or it just doesn't matter whether or not it's got health benefits or not?
Yeah, I would say it really doesn't matter whether it has health benefits or not. If you're needing it where it's controlling you, like when you have an addiction to caffeine, it's controlling you. I mean, how many people can't roll over out of bed without, got to have my cup of coffee to get me going? That's something that's controlling you. It's a stimulant. And, not to say, oh, no, this isn't good, this isn't good. You still make your own choices, but it is an addiction. It is just like, let's say, exercise. It's a good thing, but that can be an addiction,
Mm.
right?
And if
Anything really.
and if someone's listening in going, "Oh, I really like my coffee. Sometimes I do get those kind of experiences where I get sort of headaches and stuff if I haven't have it, so I do have one." And they
Mhm.
want to kind of break that cycle, where do they start?
Sure, great question. So one of the big things, and this kind of opens up like more complexity to it, but a term called methylation. And it is are you methylating? Meaning, so the umbrella, the big umbrella, methylation is a very complex process that our body does naturally, but it's responsible for optimizing your DNA. It's responsible for absorbing nutrients, and it's responsible for detoxification. So if our body can't detoxify that caffeine, we're going to have adverse effects. We may have shaking. We may have, different physiological responses to it that aren't normal when you put something in your body. Um, but it's really a case by case. And there's so many, as you said, being touted as a health drink for many, and, mushroom coffee and use this and use that, all those kind of things. It'll rev up your metabolism. That's all marketing. I'm not anti-coffee, but that's all marketing. And it really depends on your individual metabolism. So back to your DNA, and can you metabolize it and break it down safely? And how often are you drinking it? And is it controlling you? Or do you have a cup of coffee whenever, every once in a while? It's Kate, to me, this is kind of the big picture. There's 8 billion people in the world with 8 billion different sets of DNA, yet we want to treat everybody exactly the same. And we don't get the results because they're not. They're not. If you're not physiologically, you're not designed biologically the same as another person, you're not going to metabolize the same way. Your body isn't going to methylate the same way, detoxify, absorb, all of those things.
Mm. Well, I know one of my friends, she has an autoimmune condition. Does
Mhm.
that make someone more susceptible, or are their gene pathways, impacted that would affect them when it comes to addiction? Because when it comes to coffee, she said even if she has one a day, she loves her one a day in the morning. If she has that for a period of time and then she misses one day, she suffers quite badly, like severe headaches, migraines, whatever. So then she will
Mhm.
go off, try to like taper off it, but she can't just go straight off it. Otherwise, she has to take a week off work because
Yeah.
the withdrawals are so bad just from a once a
Yep.
day. Whereas
Yep.
other people can have one a day and, then they probably go 3 or 4 days with no effects going off it.
Right, right. That would be more of a detoxification issue for your friend than a direct link to autoimmune. Autoimmune, the different biomarkers that we would look at have to do with inflammation. And certainly there we would see the autoimmune optimization that we'd want. But that's more of a detoxification of are those pathways working correctly or not for her. I mean, I can tell you myself with caffeine. I got off of it successfully several, probably 3 or 4 years ago, maybe even more now. And it was difficult because, I mean, literally to say pain in my body without exaggerating, say pain, literal pain in my body from trying to get off of caffeine. And I wasn't an all day, every day drinker of every day, but not all day drinker of caffeine. But for some people that can't break it down and metabolize it, and not detoxify, it's an experience to try to successfully get off of it.
Mhm. I've never drank coffee and I don't really
Good
drink
for you.
tea.
Good for
So
you. I'm a tea drinker now. Yeah, yeah. That doesn't bother me.
yeah, one less thing to have to worry about for now. But on the subject of pain and addictions, how do they cross over and what's the link with them there?
So several of the markers, the biomarkers that would have to do with pain also cross over with depression. So the mental health aspect of it. And with addiction, there's always a mental health underlying, whether it be depression, whether it be anxiety, whether it be ADD, ADHD, whether it be OCD. There's always a co-occurring situation there of the beginning of why do you even have the need to change what you're experiencing in your body. So that depression part is a very big aspect of pain as well as addiction. And we can identify those biomarkers.
That's really interesting too.
Mhm.
I've only had a little bit of experience with sort of the mental health side of our system in here in Australia, but what I have seen is that a lot of the time the approach is, trying to get some type of diagnosis and then medication, and then because the system is very overrun, they get pushed out as quick as they can.
Mhm.
Is it similar to where you are in the States, or is it gradually changing more to work and integrate the sort of gene, like learning about the gene expressions and using that with clients to come up with better treatment systems?
Yeah, it's definitely used more here. Our system of healthcare is not a national government system. So that kind of changes it a bit. It's not mainstream. You're not going to go to just any GP and say, hey, I want to get this looked at. They probably will not know what you're talking about because this stuff is so new. Like looking at these errors in the genetic coding, the technology, the actual science aspect of how we look at it only came about in 2015. And then, we had COVID and all these other things going on. So it was not here. This is what's brand new. So it takes time. And in science, I mean, something that happened like you would think it was yesterday is takes 25 years to get to that point, that it's disseminated and through everyone. But from the different aspects, definitely more utilized here. But like I said, we have quite a few patients from Australia, people learning about these things and then reaching out to us saying like, hey, I know this is out there, it's available. It's not offered by the healthcare system in my country. How do we go about doing this? And we drop ship the lab kit to them, and they do their samples and we get it back at our lab and we just go from there as if they were next door to us.
Well, that's amazing too, that then it's still accessible even if you are on the other side of the world.
Absolutely. Yeah, absolutely. And that's a really beautiful part of how technology can be used for good today. We go over like a 2-hour, very extensive appointment because we're going over each one of those biomarkers, those 85 biomarkers that we looked at to understand what the clinical correlation, what do they do for you? What are they supposed to do for you in your operating of your body? And then if there's any errors in it, understanding what that means and then what we're going to do about it. Not just admire like, okay, here's what's going on, but okay, next step. What do we do next?
Yeah. And for someone that, maybe they have, a loved one that's battling addictions and they've tried helping them
Sure.
from the heart, but nothing
Yep.
seems to be working. Um, are people, when it comes to, say, working with you guys, does it need to be coming from the person directly reaching out, or do you have loved ones sort of reaching out for more information and then passing that information on to their loved ones?
Yep. Often with addictions, it's both. It's the person direct or it's their loved one saying, hey, I heard this. Why don't you listen to it? If I'll reach out, I'll find out the information. They talk to them. And the beauty of it, Kate, too, is that if this is something that you find embarrassing, I don't want anybody to know what's happening with me. Nobody does need to know. It's drop ship to you. Let's do it. Let's get it going. And you can be doing treatment and not even have to necessarily go away to a facility. And you can keep on with your job and your responsibilities with your family and all those other things.
Mm. Well, I think there's also that sort of underlying thing when it comes to addictions that people don't think they're addicted because they, a family person, they function,
Yep.
really well,
Yep.
they hold down a job. So
Yep.
whatever they may be using, they in their mind, they're not addicted to it.
Right, exactly. It's that functioning part of it. It's like, well, I have a good job, or I go to work every day, or my family hasn't kicked me out. There's no problem. Everybody's doing it. All those things that people tell themselves is if it's even on your mind of, do I have a problem? Do I not? Answers probably when you're being truthful. Yes, there is a problem for you to even have those thoughts of, is this a problem? To ask yourself if it's a problem, you already know it's a problem,
Mm.
right? So
And
oftentimes it is family who reaches out to us.
yeah. And also, I've noticed within my family with addictions, they may have like alcohol might have been the original sort of addiction, and then
Mhm.
gambling sort of became
Yeah.
another addiction. Are they
Yep.
linked when it comes to addictive behavior, or is it just kind of like an individual thing, or is that related back to gene expression as well?
Great question. So when we're looking at the neurotransmitters, the brain chemicals, dopamine is what we call the reward, the brain reward cascade. So let's say it's whether it be alcohol, whether it be gambling, you're getting that dopamine spike for the behavior of the drink, for the behavior of gambling. You get that dopamine spike, that's what you're after. And then the genetic components of it, where we're looking at, is your body able to break down dopamine and serotonin, all of these different neurotransmitters. So it's layers of complexity. And we call it addiction swapping. Someone may say, you know what? Everybody thinks I have a problem with alcohol. I'll show them I don't have any problem with alcohol. Then gambling becomes a problem, or porn, or sex, or shopping, or food, or whatever else it is that you're going to self-medicate with. And then you just jump back and forth in that time that you're trying to tell yourself there's no problem, or I'm going to show you to your family members if there's no problem. It's still trying to get that dopamine spike. It's still, let's say, that GAD1 gene is involved where we never get to the calming. So we're trying to use other substances to get to that calm. So it's still the same thing. It's just what you choose. And even as far as what is someone's addiction of choice, oftentimes it's whatever age you find that, right? So maybe it's when you found alcohol, you're like, whoa, for the first time, I feel calm. This feels good. And it works until it doesn't work. And then it becomes your problem. Or it might be gambling. It was first time somebody said, hey, let's go to the casinos. Let's go play the pokies, whatever we're going to do. I'm like, wow, this is so much fun. And I feel good when I do this. So it's whatever you find. It's always been there. It's whatever you find that says, whoa, this feels good.
Mm.
And I actually did a TED talk about this, understanding the biomarkers of addiction. And that's exactly what I say. It works until it doesn't work. The first time you find it, you're like, whoa, that's it. That's the feeling I've been looking for that I never had. But you never get that again.
Yeah. And I
And
know, again, from my limited sort of knowledge when it comes to mental health, that when we're talking about depression and that there can often be issues with serotonin production or
yep,
and whether or not that's from the brain or even from the gut, because a lot of the research coming through now
yep,
is the majority of our serotonin is made in the gut. And if we improve the
right,
diet, then we reduce symptoms of depression.
right.
See how that's now linked with addiction as well.
Exactly. Really, 90% of your serotonin is made in your gut. So let's take the point, somebody who's not even to the point of addicted yet. They're new on their journey and they're drinking most days of the week. You start changing that microbiome, you start changing that gut flora, then there's problems within your GI. You're not making the serotonin the way you're supposed to. And what happens? Anxiety, depression. I mean, anxiety from someone drinking is initially you're like, oh, I feel calm. Next day, there's all this anxiety and the depression because with your brain chemicals, they're always trying to be in balance. That homeostasis, your body's always trying to find that balance. So it's going to be keep on, boom, boom, boom. And really, that anxiety drives that balance between the primary excitatory neurotransmitter and primary inhibitory, glutamate and GABA. And now we're no longer a seesaw where, whoa, both of these guys are messed up. I mean, when we see the labs on people, they're extreme. They're extreme. And there's no middle ground anymore. And so much is the gut.
Mhm. And again, I know from some of the research that I've done, a lot of the antidepressant medication and that works on brain chemistry rather
Mhm.
than gut chemistry.
Gut,
So
right,
I've read that it works for some people, but the reason, maybe one of the reasons it's not working for other people is because it's not working on the gut, where that needs to be added in.
right, right. We're trying to put a band-aid on something and you can't because you've got to really overhaul the whole system. We want to find, because we've been educated this way, we want to find a single molecule solution to a problem that's not a single molecule problem. I mean, addiction has so many layers to it. We're just talking about the biological piece. What about the psychosocial piece? What about that person's experiences and their history? What I call the big T's and the little T's, the big traumas, the little traumas. What's happened to you, your story in your life that adds to all this? There's so many layers to it.
Mm. And from, being someone that's had a family member and that with addiction, and, we've had to battle with it for many years in the sense that of support. I've kind of
Mhm.
myself, in my 40s, gotten to the point where unless they tell me that they're ready to want to make the change, I'm here for
Right,
support, but I'm not overdoing the trying to help anymore because
right,
it hasn't. And I've sort of gotten to the point where unless they tell me that they want to make the change, whatever I do is not going to force them to make it. So
right.
I'm stepped back a little bit in that sense. And so I'm sure there's many
Yep,
people listening in that have kind of been through their own battles. But when it
yep.
comes to, someone that may be supporting someone, do you have any, sort of guidance for them in that sort of situation?
Absolutely. What you said is the exact picture that most people go through. So I would suggest saying, hey, I heard this podcast. I think it's something you might find interesting because what it does is takes any kind of moral flaw out of a stigma that still exists. We say it shouldn't, it doesn't, it still does, right? Because if someone, let's say they were a diabetic, we wouldn't say, why are you so weak? Just stop eating that. With alcohol or whatever the addiction is, we're like, just stop. That person by this point just can't stop, right? There's the biopsychosocial piece to this now. So I'd say, I heard this really good podcast with Kate Boyle. I really think you'd find it interesting. It really kind of talks more about the science and what's happening. And like anything else, it's a disease. On a cellular level, it's not functioning in a normal way. I think you'd find it really interesting to say it can be identified. And then from that point, you can optimize what you've got to work with instead of this is me, this is the only way it's ever going to be, because it's no fun for that person. That person is in at least emotional pain, if not physical pain every day. It doesn't have to be that way.
Well, I think that's, brings a lot of hope to people. And like you said,
Definitely.
it's a nice open way to be able to have this
Yep.
conversation with someone.
Yep. Yep. And then just give them a podcast. You don't even have to sit there and listen to them. Just, here, take a listen. If you want to talk about it, I'm here to talk about it.
Mm. And I want to cross over to pain a little bit. Working in sort of the movement space, I often have clients that come in with chronic pain. And as
Yep.
you're sort of saying with addiction, there's always underlying layers or other layers.
Yep.
It's not just one thing. There's usually, it may be emotional, physical stress, social, whatever it is. Is there any crossover with genes and people being more prone to having or suffering from chronic pain? Or is that, again, more of a sort of inflammation piece that crosses over with addiction?
So the inflammation piece, but we look at, I don't know, 20 some odd, 23, I think, inflammatory markers for a reason that we look at so many, because that inflammation can create pain. I mean, inflammation can create brain fog. We now have a whole title we call inflammaging, because it is aging you way faster than it needs to. And that inflammatory piece is such a large part of it. Even something that we look at now in the category called autophagy. So we've known about autophagy for, 50, 100 years, but it was only in 2016 that a Japanese physician won the Nobel Prize for understanding what it does. Essentially, it's the garbage man of your cells. Every day cells die off. They're supposed to. But we have to have a way of getting rid of the dead cells, getting rid of the garbage. If we don't, literally, the garbage piles up. That is going to affect that individual cell, but enough garbage piles up, it's going to affect all the other cells around it. You're going to feel like garbage, literally, right? So that adds to the pain piece. So again, it's not single molecule here, problem solution, it's layers. That's why we look at so many different biomarkers, because they all have a piece in what we're looking at.
And
Even let's talk about mitochondria, how your body makes energy, right? If you don't have energy, you could be sitting on the couch for days and like, am I depressed? I don't know. Is it mitochondria? I don't know. Is it both of them? I don't know. We have to get objective information to know where that's coming from. And if you're not making energy, what's chronic fatigue? That's pain, right? We're not making the energy. So many different layers, which is why it's complex and why we look at 85 biomarkers.
mm, I also find from a practitioner point of view, it can be very difficult because say someone makes it to me for their physical pain, I know that
Mhm.
I can only work on that so much because I know that there's other factors. But
Yep.
sometimes they're not open to wanting to see a psychologist or a counselor or whatever it may be. So we
Right.
can take them so far, I can take them so
Yep.
far and we can build that relationship and we do build that trust. But unless, and sometimes it might not just be they're not ready yet, but then it might also be a cost factor or a time factor or,
Mhm.
those sorts of things too. So from a practitioner point, it gets very difficult to manage that pain because, as you
Sure.
said, because it's multifactorial, we can only do one
Yep.
part and then we need others to
Yep.
come in. So
Yep.
how do we, in your sort of opinion, start to integrate this when we have some of those constraints?
Great question, Kate. So we work with different types of practitioners, and they incorporate this with their clients and their patients. Like we've gotten so far, or this is a piece of the puzzle for this individual, and they do that as well. So then you get all that information back. We go over everything with your patient, but you also are now like, whoa, I'm aware of all these different aspects going on and can really zero in on what's happening. And it's kind of like now we have this great integrative team approach that everybody's going to benefit from.
Because yes, I do find that's one of the hard things that I come up against. And, most people find their way to me if they've got chronic pain through a referral through it might be a doctor or their chiro or someone like that. So they
Right.
they already have some system in place. But then as
Yep.
we move to looking at, say, the inflammation piece or emotional trauma piece or that can sometimes where we can face a block almost.
Yeah. 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 And that kind of goes back to the somebody thinking that there's a like I'm less than, if I have to go look at these other things. That's not the case at all. I mean, not at all. Everybody's just trying to get as much information as we can and as much resources as we can to get that person optimal. What's the best you we can get you to?
Mm, I agree, because that's what we're working on all the time. And I think, as you
Yep.
said, those stigmas and judgment is still, even though we don't want them to be there, they definitely are there. And it's trying to remove them as best we can and then support the clients and, show them and tell them the science, the back science around it as well.
Right. Right. And that really removes when you just speak to the science aspect of it, it's like, wow, this makes a lot of sense. I can't tell you, Kate, the amount of tears when we go over reports, but they're tears of joy because the person says, this is exactly how I felt. And I feel like no one ever believed me. And they feel validated. Like you could tell me nothing in an intake, and I'm going to get these results and I'm going to say, so this is going on. Like, what? That's exactly what's happening. But it validates everything that they've experienced. And there's tears.
Mm. And before we finish up, I just want to touch on sort of the pain cycle that can happen that leads to addiction when, say, someone has to go off, maybe have a surgery, then they're
Right.
in a lot of pain. So then they get told, they need to go on, painkillers, let's just say, and then they get addicted to the painkillers and the
Right.
cycle goes on, from there. What
Right.
can we, if you a client had it recently, she had a knee replacement. She didn't even realize that she was kind of in that addiction cycle until her husband, who I teach as well, came in and he said, I had to say to her, you have to get off these. Like they're
Yeah.
affecting you physically, mentally, you
Right.
so how do we sort of deal with that if someone is going through that as well?
Sure. So that's a perfect example of somebody that had a lot of all these things that we've just talked about. And if that was identified beforehand, it'd be like, okay, we're going to have to really be very cautious of what we do. Maybe 48 hours is 72 hours only. And or look at other ways, other allied professionals that could be of help with pain control, maybe acupuncture, maybe, any of these other types of things, because you're not going to be somebody that could take it for the 2 weeks, whatever meds, and then be done with it. And if you already know that, okay, we need a different plan. If you don't know that, exactly the case that you just talked about with the husband said, this isn't doing good for you. This is not how everyone reacts to this. So having a plan in place before it is so important. So
Mm.
important. Even with surgeries, of having a plan in place, when we go over some of the markers that have to do with detoxification and see that somebody's really got some serious weaknesses with, for example, glutathione, and being able to post anesthesia be able to clear all that out I was going over results with an individual, and he had, when we look at the pair of DNA, so if there's one error, it's what we call heterozygous. If there's two errors, we call it homozygous, so that whole gene. And he had several in this area. And I said, so if you're ever going to have any type of anesthesia, we're going to have to create a program leading up to that for a good 3 weeks before you get to that point. And he said his mom died on the operating table from anesthesia. And you just like, wow, the power of the information, the power of the information. That didn't have to happen. But we didn't have that science when his mom died from that. But to him, it was like I mean, his eyes were huge. And then he told me that. I'm like, okay, so you see the importance of this. So if that's ever the case, we're going to come up with a program. And for your listeners, what glutathione does is allows your body to detoxify. Your liver makes glutathione. If it's not making enough, you're not going to be able to detoxify. You're not going to be able to clear that anesthesia out of you. And it can be very serious.
Mm. And if that's the case, can someone take supplemental glutathione, or is it not very effective?
Yeah, different types. You can do it intravenously. You can do it with liposomal. The problem with like over-the-counter supplements becomes the regulation of it, and you can market it as the best glutathione in the world, and maybe it has this much glutathione compared to this much filler, and you're not getting the glutathione that you should. So really talking to a professional who understands what would be best for you, where your weaknesses are, what you're going to be able to metabolize, what we need to do, and be cautious. Never buying products on Amazon, because the two most counterfeited products on Amazon are beauty supplies and supplements.
There you go. That's an interesting piece of
Yep,
information there.
yep, yep. It's really a tragedy, but people do it. They don't know. So now, spread it around.
Mm.
But yeah, it's so important, so important. And so much can be, you can go into the surgery saying, I'm as good as I'm going to be. This is great. We're not going to have any problem. Your body's ready for it. We've given it every little edge that it needed, and you'll be fine.
Yeah. But I also think, I work with a lot of the older population, and many of them go in for surgeries, even minor, they're not major ones like knee replacements, but they can be minor surgeries in the scheme of things. I don't think any surgery is minor technically, but they'll
Okay.
come in and say, "Oh, I'm just having, a hernia repair or something that's small." But I'm like, if there's still an anesthetic involved, then there's still a risk. And
Yep.
having this type of information, I think, especially as we age, can be very invaluable, as you said.
Absolutely. Absolutely invaluable, and could really alleviate so many of, life's problems and tragedies that didn't need to happen.
Mm. Now, before we sort of wrap up, is there anything else that you'd like to highlight about, addictions or pain in this conversation that maybe we haven't covered?
I think you covered everything. I think you did a really good job, Kate. It's understanding that we're all, like I said, 8 billion people in the world with 8 billion different sets of DNA. Here, take this, do this for the person that was before you or after you at your doctor's office doesn't necessarily mean it's going to work for you. And so much can be prevented, so much can be optimized. And understanding that addiction is a disease and we need to treat it as such, like any other health care. It's not a separate entity like you got yourself there, get yourself out of there. It's a disease and we have to treat it as such. And in that, find out where is the root cause of all of it? What's happening with you individually? And let's address that. And life is meant to be a gift, not meant to be a struggle every single day.
Well, I hope, there definitely is signs that our sort of healthcare, there is more individualized, approach coming through in some sectors. I think it's
Mhm.
just the overall health system takes time to catch up to that and find funding for that as well.
Definitely. Yeah. It takes time and funding. Once this like, okay, the science is there, now we have to find the money for it. But in the end, it's going to be blanketly so much less expensive because we don't wait until it costs us a fortune, because we can be making the changes, optimize, and prevent so much.
That's the key, isn't it? It's preventative,
Yeah,
but
prevention.
unfortunately, our systems seem to be more reactive than
Right,
preventative.
right. Acute care, triage, stop the bleeding, move on. We should be further than that. The science has given us more. We should be employing that science.
Yeah. Well, that's why we have amazing people like you that are
Yes,
advocating and fighting for it so that more of this information gets out there. And as we've sort of said through this podcast, you're in control. Like you can take charge of your health, and this is one step, that you can do it. So if you can, why wouldn't you?
exactly. Why wouldn't you? Yep. I mean, your life, your health, that is your biggest asset, your health. Because without it, you have nothing else. All the other things don't matter. So that's really what needs to be the focus of keeping yourself as good as you can be.
And I think a lot of people take their health for granted until something goes wrong. And then sometimes, unfortunately, by that time, it's a little bit too late.
Right, right. Yeah, that's definitely the case. Most people don't realize what the value of it was until they don't have it anymore and say, I had no idea of what I had. You just assumed this is going to go on forever.
Yes, but unfortunately, we don't. So, and as we
Right.
age, it gets harder, as you sort of said, with, the aging process and that too. So, we have to sort of focus on our health even more as we tend to age too.
Absolutely. You've got to put in a little bit extra, it's just the way it is. We
For
we
sure.
get we gain more wisdom. We have to do a little bit more physical work in the other parts of it.
I agree. Now, before we wrap up, where can our listeners reach out and connect with you?
Sure. So our websites are wiredforaddiction.com and wiredbiohealth.com. So we started out with Wired for Addiction, and some people came to us and said, I'm not quite at the addiction side of things, but I know I'm not right. So can I kind of try to get ahead of this? And we created the Wired BioHealth arm of what we do. So wiredforaddiction.com, wiredbiohealth.com. Go to the websites, look over everything. We even offer a 15-minute consultation with our clinicians to tell us your story. What's happening? What have you done so far? And then offer suggestions, what would be most beneficial. But I would definitely suggest that reach out and have a conversation.
Amazing. Well, I will link that all up in the show notes too. So, listeners, you can head across there to check that out as well. But thank you so much for coming on the podcast today. I think these types of conversations are the ones that we need to be having more and more. I don't know the stats on addiction, but as I said, I'm one of four kids, and two out of our four of us have had a lot of issues with addiction. So, they seem to be in my world quite prevalent, and I'm sure
Mhm.
in many others as well.
Absolutely. And you're right about at the mark when it comes to mental health and addiction. Genetics play a stronger role, 50 to 53%. So kind of right down the middle, you are there. But yes, it's there's so much more that can be done today, and we really need to take advantage of what's out there.
Well, thanks for coming on and, sharing everything. It's been a pleasure talking to you today.
Thank you, Kate. And thank you for the work that you do, because having these kind of open conversations really allows people to stop, whispering and talking about it in the corner, but just talking about it. It's science, it's real, it's life. And what you do is amazing because it brings it home, literally home to people where they can sit there and listen to it and say, let's have a conversation about this. So thank you for your work.
Thank you.